Big Blue Book Club presents Snack Club with Courtney Luecking and Anna Cason, featuring raising a happy, healthy eater and how to raise a mindful eater. Now, here are our hosts.
Feeding children is an adventure, and at some point or another, you might have had questions like, am I doing this right? Or is this normal?
Headlines, things we see online, things we hear from family and friends, and even unpacking what we see in the store can have us questioning what to feed our children. We want children to have what they need to lead happy, healthy lives, and it seems like as soon as we figure something out, it changes.
That's where we come in. My name is Dr. Courtney Luecking. I'm a registered dietitian and extension specialist for family and child nutrition. This means I have lots of training and expertise about child nutrition. I also have two littles of my own. This combination allows me to talk through practical, science-based strategies for creating a nourishing feeding environment for your family.
And my name is Anna Cason. I'm a registered dietitian and extension associate in food and nutrition. I don't have kids of my own, but my interests and passion lie in supporting healthy food-related behaviors, which begin in childhood.
In partnership with the University of Kentucky Cooperative Extension Services, we present Snack Club, where we share bite-sized bits of information for supporting nourished, active children in Kentucky.
So come for the snacks and stay for the support.
Hi, Anna.
Hi, Courtney. How are you?
I'm good. How are you?
I'm doing well.
So it looks and feels a little bit different today.
We've got some special guests with us.
We do, and we look like the Brady Bunch on our screens. So it's a super fun day, you all, because we have phoned friends, and this is like personally and professionally interesting to me. And I think because my daughter's habits have been changing gradually over time, and now I'm like, I'm wondering if we're at that point where I should reach out to some support. So today we are thrilled to have three guests with us. We have Jamie Adkins, Dr. Suzanna Attia, and Sarah Estill. And so we are going to let them introduce themselves to you to tell us a little bit about how they interact with children and families, both professionally and personally. So I'll just point to you all as we see you on our Brady Bunch screen. So Jamie, would you like to introduce yourselves to our crew?
Yes, hi, my name is Jamie Adkins. I'm a speech-language pathologist and lactation consultant, and currently I'm working in Kentucky Children's Hospital with our pediatric patients. And I'm also the mom of two boys. I have a 7-year-old and a 2-year-old. And I will say I have a personal investment in this topic as well, because my 2-year-old is starting a picky eating journey of his own. So I've been very interested in these books and this topic as well, personally as well as professionally.
Wonderful. Thanks for joining us. Dr. Attia, let's hear from you next.
Hi, everyone. It's great to be here. Thanks, Dr. Luecking and Anna, for the invitation. So I do pediatric gastroenterology, hepatology, nutrition. So gut, poop, vomit, feeding, nutrition, and liver, all that good stuff. Also at Kentucky Children's Hospital / Kentucky Clinic, University of Kentucky. And I also have a maternal experience with two girls under the age of, well, one's 3, one's 1. So under the age of 5. So quite a journey indeed.
Pulling in strong with experience here. All right, Sarah, and we'll have you round out our introductions.
Thank you. Thank you again, Courtney and Anna, for having us. My name is Sarah. I'm one of the registered dietitians at Kentucky Children's Hospital as well in the Department of Pediatric Gastroenterology. My journey has been interesting. I started not in peds, and my end goal has always been to be in peds. So I actually just completed my master's in maternal and child nutrition with a focus in clinical lactation. So I've had a very strong interest in introducing new foods, working with infants and allergens, breastfeeding, all the way up through picky eating into adolescence. I also have some great maternal experience. I have a stepdaughter who is 10 and my son who just turned 4. So my adventure continues with, navigating parenting and picky eating and things like that as well. So I think we have these challenges to make us more prepared and empathetic with families. So yeah, so very happy to be here.
Yeah, thank you all so much for joining us once again. We are thrilled you're here and just thrilled to hear your expertise both personally and professionally about some very specific topics. So we'll get started. We'd like to start by talking about eating behaviors across childhood. So what is considered normal, and when might it be time to seek professional help?
Anna, that's a great question. So, as we think about normal feeding behaviors, they, of course, change over time. So in early infancy, one of the main aspects of normal versus not normal feeding would be if the infant can actually suck down enough liquid nutrition, whether that's human milk or formula, in order to grow properly. And so, of course, as we move into the introduction of solids and trying to wean off of milk, whether human milk or formula, that becomes increasingly important to pay attention to growth still, but as well as are they able to start introducing more diversity in their diet over time? Are these children able to have a reasonably pleasurable eating experience where the food is going down into the stomach, it's not causing significant distress to them, and hopefully neither to you, and they're able to grow and maintain their developmental milestones, as well as being able to do that with introducing more and more different textures and types of foods in their diet. So then over time, as kids reach the toddler age, it's normal to start inserting independence if a child is developmentally at a toddler age and wanting to fight you a little bit on what they are and are not eating. So we get in this age range a lot of picky eaters. However, it's not normal when they're refusing to the point of inability to gain weight, or they are having difficulty actually chewing or swallowing the food and getting it down, or they're having significant vomiting or regurgitation with all of their meals, coughing and spluttering with all of their intake, or in general, you just think something's not right. So I'm going to pass it on to Jamie to give us a little bit more perspective from the speech language pathology standpoint.
Thank you, Dr. Attia. I think I'll just give a little bit more detail on what we're looking for when we go in for speech language pathology and we're assessing kids in these different age ranges. So in that very young age, kind of that 0 to 6 months range, we are looking a lot of just the motor skills, like can the baby physically take in the food that they need? And on top of that, we're also looking at, because we're speech language pathologists, we're looking at it sort of from a communication standpoint. How engaged is the baby in the food? Are they starting to communicate to you as the parent or the caregiver that they're interested in feeding, that they want to eat, or are they starting to tell you that this is difficult, it's not fun for them, or there's something that they're not interested in? And for very young kids, those are often our first red flags, as if what are they telling you? Are they telling you this is fun? Or are they telling you it's not so fun for them? As they get a little bit older, that's going to get a little bit more clear and easier to see. In the beginning, it may look like they're just not excited, but then as they hit that 6 to 12 months and toddler age, those behaviors can really pick up and they can start being pretty strong in their refusals and telling you what they're interested in and what they're not interested in doing.
Jamie, I had a quick question for you. When you're talking about communicating, not into this, or I am, can you give us some examples of what that would look like for those infants, and then kind of how that might change as we get into toddler age?
Yeah, absolutely. And I think it's easiest to see when a baby is interested. And anything that doesn't look like that is a red flag. So babies that are interested in feeding and find it fun and enjoyable and easy, they're going to let you know when they're hungry. They're going to start cueing, rooting around, maybe crying, getting fussy, and telling you that there's something they want to be doing. And then when you give them that food, you see them instantly get excited and relax. Get excited, attach the bottle, attach to a nipple, and then they just relax into it Their faces get calm, their body gets calm, and sometimes they'll eat until they literally just put themselves to sleep. So if you have a baby who doesn't look excited at the beginning and relaxed towards the end of feeding, then there's probably something that they're not enjoying about that experience. And that can be like either pushing it away, shutting down, getting more fussy as the feeding goes on, just anything that doesn't look like a baby that's starting to get calmer and happier as the feeding progresses.
That's really helpful. Thank you.
Okay. Sarah, did you want to take it from there and give some more information from your all's perspective?
Sure. Yeah. So again, I'm Sarah. So I think it's just important to remember that the first year of life, that growth is so rapid. Infants are going to double their weight gain within just like the first, 6 months to triple it by the first year. I think it's important to know that after that, things do slow down. So I think sometimes parents have this expectation that, this the frequency of feeds and how rapid they're going to grow, and that should always continue. But I think it's important to know that the first year of life is very busy. It's all about exploration. So monitoring those feeding cues, monitoring and, allowing them to kind of make messes and tolerating those messes can be really hard. But that exploration around 6 months up to that first year of trying those new foods can really set us up for the next year and years to come. But I think that first year, it's a learning experience for everyone, right? So it's really important just to stay engaged and kind of going off like what Jamie and Dr. Attia were saying, that looking for things that don't seem comfortable, listening for audible swallows and things during those first 6 months and seeing that weight gain. I think the most important thing that really determines what we would consider normal from a nutrition perspective is growth. So what we are looking for is, some babies eat every 2 hours, some eat every 3 to 4. When they get a little older, they may pace themselves differently than your first child or your friend's child does. But as long as we feel confident in the foods that they're consuming and you feel like they're safe foods and you have plenty of access to those foods and babies are growing, I think it's really important to just pat yourself on the back and know that you're both learning and growing together. And the years to come are just going to continue to be exciting and introducing all those new foods. So
I love how you all have kind of talked about embracing the mess and some of the things, like I'm thinking as a parent, you're like, oh my, I have to clean that up on the back end. But really that opportunity to engage with senses and experience foods in different ways. So we've talked a lot about our youngest of children, so our infants and our toddlers when they start to express that autonomy. What about like kind of our elementary school age children, or thinking about that middle school? And this is where I'm personally interested because I'm like, it seems like my toddler autonomy assertion is coming later in life. Is that normal? Or like, yeah, tell us about what to look for during that space of life.
I can start there. So from a medical perspective, some big red flags would be choking after eating. So swallowing, and then after swallowing, food is getting stuck and requiring sometimes vomiting it back up or drinking a ton of water to get it down. And it's happening more than once, like not just 1 or 2 times, but a repeated basis. Pain with swallowing or pain after swallowing or immediately during eating or right after eating, as well as a stepping from a behavioral perspective, like stepping away from the food routines of the family, no longer having comfort being watched when or observed when eating, or eating, like restricting eating, like going from having a fairly, what you would consider in your family, normal diet to over time, suddenly or slowly, no longer accepting foods that were previously accepted, especially like 1 or 2, okay, but a dramatic difference in that. So that would be restricting eating. And then on the other hand, binge eating. So having like excess consumption of food in a single serving, especially when it's not observed or when the child is starting to do that secretly. So those would be some like medical red flags. that I would definitely recommend should be brought to the attention of your primary care physician. Jamie, did you want to take it from there?
Yeah, from our perspective, I think the old way of thinking about things, and old as in maybe even just 5 years ago, our assumption for a long time has been that by the time kids are in preschool, they pretty much have all the motor skills they need to eat, and they're pretty much good for the rest of their lives. But as we've learned more and people have actually done more research on this, we realized that the development of eating, just the motor skills for eating, continue to develop throughout most of childhood up until almost middle school. So even in grade school, kids are still learning how to eat. Um, so we can still start to see changes throughout grade school. Anytime that we notice that kids start leaving out whole groups of foods, or like Dr. Attia said, you notice them begin to avoid certain mealtime activities, or avoid going to food parties with their friends, or even just, she said, maybe instead of eating with people, maybe they're going somewhere else to eat in secret. Those are red flags that we're seeing with some of the kids that we work with. It's interesting too within these ages, because kids have a wide variety of skills and a wide variety of comfort levels with how they're able to express themselves. So sometimes it's very clear and obvious, your child's coming to you telling you that something's difficult to chew, or that something doesn't feel right when they eat it. But other times you still have to be a little bit of do a little bit of detective work with them and say, well, something is just not working right. Meal times just aren't fun anymore. These snacks just aren't easy for us anymore. What's going on? Maybe we need to reach out and get some help and see if there's something going on underneath here that I'm not able to pick up on.
Great. Sarah, do you have anything to add to that? Or otherwise, I'm like, oh, I want to ask then who we reach out to if we are thinking some of this applies to us.
Yes, so I will definitely, in support of all of what they have said. I think the consensus is that children are going to develop their own positive or negative experiences around food. So I think discussing food culture and talking about what is normal and what's not normal, and having consistency with mealtime. And in today's society, that is like the number one thing that we all struggle with, right? Having that consistent mealtime where we have dinner on the table and we're all sitting together with no distractions, no, screens going on. And I think ultimately, as long as we can instill those goals earlier on, when they're young children and they're infants, by the time you hit that elementary school age, middle school age, you've sort of already created the foundation of what a positive meal experience should look like, right? So kind of like what Jamie was saying, when you start to notice these things, or they do start avoiding foods, they may have the confidence to speak out and say, hey, this isn't right. Like something feels weird. I feel like I'm having a hard time chewing or swallowing, things like that. I think ultimately you have kind of two spectrums. You have the overeating and the undereating. So I think if you, in conclusion, feel like your children are, erring on one side or the other, it is important to reach out and ask those questions. I would say starting with them first is the best place, because sometimes we have positive peer pressure from schools, but then sometimes we have negative peer pressure from school. So we can kind of see where the root of the problem is on our own. If we're not able to do so, that's when we should reach out and get counseling and guidance to kind of catch it as soon as we can and start those interventions to, promote just longevity and healthier eating habits and things like that. So.
Gosh, so
if I can, I know you want to segue. It's a beautiful segue to the next topic. But I do want to just add something before we move on, that, as you've heard a little bit today, eating is an emotional experience as well as a physical and sensory experience. And a lot of learning healthy eating and avoiding picky eating to some extent, not completely, is also what behavior we model and how much we introduce a diversity of flavors, especially more complex and bitter flavors earlier on in life. And I think that's a really big challenge for a lot of us. So you heard us mention trying to have family meal times, trying to avoid, screens and other distractions at the table. I would add to that also, like, we as adults sometimes don't realize how we're modeling negative reactions to foods that our kids may actually, without our input, enjoy. And so we need to be careful not to show a negative reaction to a food that they're still developing an experience to. So I think that's important as well as trying to introduce like complex and bitter flavors, especially vegetables like broccoli, cauliflower, Brussels sprouts, the types of things that often missed later on earlier in life, as early as we can. So I just wanted to add that, and it's really important to also know how and when to reach out for help.
Yes, I'm laughing because broccoli was the first food I introduced to my youngest, and her face and the video were, I was like, I have ruined her for life, you know, and I know I haven't because we continue to offer it. It's slightly less dramatic reactions when we offer broccoli, but yes, those are an acquired taste for sure. And actually, I'd be remiss, I don't think we've hit on our adolescence, which is a unique stage of life. So what can you point out to us for kind of what's normal, what might be concerning during that adolescent age?
So just keeping the order we've kind of started, I'll just go ahead and start with that. So a lot of the things you mentioned as abnormal or red flag behavior in the younger school age child really do apply to the adolescent group as well. So in adolescence, the pro is that kids are a little more self-aware and can talk more about what's going on. The con is that the emotional and social experience of eating is, especially I would say for girls, but also for boys, and those who might identify as a different gender, is actually intensified. And then just piggyback on that comment, as I'm alluding to the possibility of the development of eating disorders, there are a lot of eating disorders that actually stem from having an actual problem in the gut, or the esophagus, or something that a doctor like me would take care of, that can often go missed. So it's important to really understand what is your child feeling if they're exhibiting any of these red flags we talked about. So at adolescence as well, like kids tend to get busier and busier depending on the resources you have available to you, the school system and extracurricular activities you may have available to you, and also depending on your, how busy you are as a care provider and how much time you actually have to check in with your child. So at this point, what's really important is to look out for these restrictive eating behaviors that we talked about, the binging eating behaviors, hiding, shame or disgust related to food, and modeling as much as possible within the constraints that you have in your family, trying to model, good feeding behaviors, eating a diversity of vegetables, fruits, proteins, starches, as well as trying to have mealtime together. And then really try to open that channel of communication. If you're concerned about something, try to just provide a safe and open forum without judgment for your child to share how they feel about their body, how they feel about their food, how they feel about meals with family or friends, and as much as possible to just listen. And that might really give you a lot of insight into what's going on if you're noticing some concerns.
Great. Thank you, Jamie. What else can you add?
I think I don't have a whole lot to add with that. I think that was very well said, Dr. Attia, and I would agree with all of that as well. From our perspective, when we're looking at it through a therapy lens, we're also looking at the development of just autonomy, because you've done most of your job teaching them how to eat at this point. You're just sort of fine tuning things with them at this point. So we're looking to make sure that kids also are they able to manage the foods by themselves? If they are home by themselves for a day, are they picking out fairly reasonable meals for themselves? With some exceptions. I mean, teenagers are going to have a day, they're going to binge on pizza for fun, but in general, are they able to manage their own hunger? Are they remembering to eat meals? Or as a parent or a caregiver, are you still having to step in and remind them to eat, or to prepare all the meals for them, or to plan everything that they're going to eat throughout the day at school? And if you're running into problems with that, then as a therapist, a lot of times that's where we might step in and offer a little bit of extra guidance.
And I think the last thing that I would add is I think just the influences that are around that age of adolescence is the biggest influence. So whether it's social media and they're seeing other people who are eating all kinds of fast foods and Starbucks and different things that they may or may not have access to, sometimes that can almost be, very negative, and encouraging them to, when they have the means on their own to have these things, they kind of overconsume it. Versus the opposite side of that, if we're only getting meals at school and things, I feel like it can be really challenging for them to differentiate if they've not had that influence from you first on what does a healthier meal look like. Are there proteins and fruits and vegetables at every meal? I think it's very important at that age, like Jamie was saying, at that point we're sort of fine-tuning those skills, but I think it is important that we still include them in the grocery shopping, in the preparation of the food, putting the food away, chopping it up, putting it in the skillet, washing the dishes, because you would be surprised how many adolescents we see that I'm like, oh, well, what do you pick out with your fruits and vegetables during the week? And they're like, I don't go to the store, So it's like they're so shocked that you would ask. So I think we just sometimes need to not overthink it as parents and just say, hey, look, you're going to go with me. You're going to help me pick these things out. We're going to do this together. I think that alone, them feeling included by you or whomever the caregiver is going to be supportive enough for them to help them have the courage, if something is wrong, to stand up and say so. I think sometimes they just need you to be in their corner, but instilling those skills and fine-tuning them, kind of like they were saying, in those later years is going to be really important for how they're going to continue to develop as adults later on in their life, once they're on their own and in college and things like that. So, yeah.
Thank you all. Yeah, I think that's great advice, Sarah, to just keep them included at all points of their life, so that they can carry them on into the future. So if we have noticed some of these abnormal eating behaviors, or if that line of communication has been open and our child has expressed some concern, what type of specialist should we look for, or should we reach out to for some of these different concerns, and where can we find them? Yeah.
Yeah, so this is a really important question. And of course, your availability or access to these different providers we're going to talk about may differ according to how far or close you are and your type of insurance. But generally, the people you're going to have in your arsenal, your team, are going to be first your primary care physician, who should be kind of your first point for any concerns about eating growth, eating behaviors. And sometimes, I guess my top tip in that would be, if you have a concern, try to bring it up at a separately scheduled appointment, if you can get one, instead of at a well child tech. If you think about it from the perspective of how the appointments are scheduled, in a well child tech, there are many things that have to be done. Whereas if you have a concern, and you bring it up at that time, if it's a mild concern and you just want to know, is the kid growing? Okay, sure, no problem. But if you have a large concern that actually needs to be explored a little further and needs more time to talk about, it might be beneficial to just try and schedule a separate appointment for that, like a sick visit. So that would be step one. And then with your main doctor's agreement, then you may be referred to someone like Jamie, a speech language pathologist, and she can talk a lot more about what that sounds like and looks like, or someone like in our clinic, seeing a pediatric gastroenterologist / hepatology nutrition. And we may incorporate the services of a registered dietitian like Sarah. So sometimes your clinic might have access to a dietitian on its own without a referral through a pediatric gastroenterologist. Pretty uncommon in the Kentucky area for that to happen, especially with Medicaid. But if that's a resource that you have available to you and you want to work with, that's great. It does help. Maybe Sarah, you could talk more about kind of pediatric versus non-pediatric trained dietitians, but you can speak more to that. And so I would say that those are kind of the first areas. It is important just to be careful about where you're getting information from. So other places, if you just want some more information, you can look at Bright Futures. You can look at the American Academy of Pediatrics website. We can give you the name for that because I'm blanking at the moment. You can look at the GI for Kids website, which is from the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. Of course, you can ask your peers, your friends, Facebook groups. Just have a small level of caution that sometimes things are certain disease states or maybe attributed to what you're experiencing and actually not be what's going on with the kid, your child. So just maybe take that with a grain of salt. So those would be my suggestions about like where to start looking and how.
Awesome. Thank you all. And Jamie, do you want to talk to us about all things speech language pathology and a little more about your services?
Yes, I'd love to. So if you go to your pediatrician and you talk about some of the difficulties that you all are experiencing with eating, you might get referred to as either a speech language pathologist or an occupational therapist. Both disciplines work pretty heavily in feeding. It is important to know that not every OT or occupational therapist or SLP, speech language pathologist, not everyone is trained in feeding. So it's important to ask. And it's okay. There are so many different ways that you can take both of those disciplines and so many different things that your therapist can learn. They are not going to be offended if you ask them if they have experience or an interest or have extra training in this area. So just ask. The speech language pathologist is going to look at things from a little bit different perspective than an OT will. So speech language pathologists were trained first in the motor skills, which means just physically, do you have the ability to chew, to swallow, to move food in your mouth? So that's one thing that we're really going to focus on. And a lot of other SLPs do also have some training in establishing mealtime behaviors and habits throughout the lifespan, and a little bit of training in some of the sensory processing that goes into eating. OTs, that's going to be one of the main areas that they look at, and that's one of the areas that they are just so very skilled in. So if you have a child who has a lot of difficulty processing sensory information, so the way things feel or the way things sound, then an OT is really going to be very helpful to help you figure out what's going on and to problem solve. They also have experience in working with establishing mealtime behaviors and working with the motor skills in moving food to their mouth. So if you have a child who is having difficulty picking food up off their plate, which we do see a lot of times, I've seen toddlers come in that they're not gaining weight or they're just not transitioning to eating solid foods. And we find out actually everything is fine except for the grip. They just can't get the foods up to their mouth. You can go to a wonderful OT that can help you problem solve that and figure out how to start gaining that weight at that point. As far as insurance, I know Dr. Attia had mentioned that can be a restrictive issue for many people. We do see that most insurances that we work with here in Kentucky will cover at least a limited number of visits for speech language pathology or for occupational therapy, and sometimes for both. You just have to check with your specific insurance company, but we have had fewer and fewer denials from insurance over the years. I think there have been a lot of good work behind the scenes that's gone on over the last decade, that those services are becoming more and more accessible all the time. And I also wanted to mention another really good, reliable resource that we often use as therapists, and that is the feedingmatters.org. So the Feeding Matters organization is a fairly young organization, but it's been established by some of the leaders in the field. It includes speech language pathologists, OTs, gastroenterologists, registered dietitians, psychologists, family members of people with feeding disorders, and they collaborate together on this group and have regular meetings, and they put out very, very good resources that have information on how do you find out if your insurance will cover this service? They have information on their website about how do you talk to your doctor if you're concerned about feeding problems. And they have just wonderful definitions on what a feeding difficulty actually could look like. And so I think that's a really nice resource to look at if you're just trying to figure out where to even get started and who to start talking to.
That's great, Jamie. Thank you. And I will just put a plug out there for our listeners that any of these resources that our guests are mentioning, they will be linked below, and we'll also house them on the Snack Club website. So if you're like me and trying to take mental note of these websites, we will link them there for you. Sarah, do you want to touch on registered dietitian's role in all this?
Yes, thank you so much, Anna. Jamie, that was, as you can see, we're a very interdisciplinary network. So like Dr. Attia was saying, starting with your PCP, I think is the most important step and you're able to have that resource, and then finding those supportive people, whether it is like a gastroenterologist or a speech or occupational therapist. But from a nutrition perspective, with registered dietitians, if you're really not sure and you don't have a direct outlet or a referral to a clinic with a dietitian, I would suggest starting at your local health department. So especially with children under the age of 5, there are programs outside of just WIC. There's one called HANDS program, and I think it stands for Health, Access, Nurturing, and Developing Services. So they give great information on each of the monthly and like yearly milestones that we should have from birth until like 5 years of age. So that seems to be when it's one of the most challenging periods, right? And then outside of that, when they are a little older, at UK, we do have an adolescent medicine team that focuses more on behavior, with eating, behaviors and things, and picky eating and stuff that aren't necessarily correlated or a comorbidity of a GI condition. And so we do have that option as well. I think it is important when you're doing research on your own and you're looking for someone that we do keep in mind, we always want to look for a dietitian, or like Jamie was saying, like speech therapist or provider-led blogs. We see lots of stuff and misinformation out there on social media about, baby-led weaning and what's appropriate and what's normal. And this is what I did for my baby. And that's okay, but we do want to make sure that it is supported and fact-checked. So the CDC has a monthly milestone and yearly milestone. I think that's a great resource, and I will share that with them as well. There's another dietitian-led blog that's called Kids Eat and Color. She has some amazing work, and Courtney makes me laugh because when you were talking about the broccoli, she sends out a weekly or monthly, I think, picture and newsletter with that child of the month trying broccoli. So it's these really fun reactions and faces of these kids all trying broccoli. And it's just a nice reminder that, like, as parents and providers, we're all figuring this out together, right? So if you start with your PCP and then you go to a therapist and you see a dietitian and you're feeling overwhelmed or you're still not sure, always ask, just let us know where your head's at. Let us know how we can support you, because we're really here for you guys. And so aside from, private practice, your dietitians are most often going to be found within your hospitals or your clinics, or, maybe in, cooperation with like a speech therapy or OT, like a special feeding place. So, yeah.
Oh, you all, I'm like feeling so much more relaxed after talking to you today. And so I hope other people who are joining us feel the same. And so just one final question to round us out. And Sarah, I think you kind of started to hint at this, but, as a parent or just a caregiver in general who maybe isn't familiar or comfortable in healthcare spaces, or just really feels at a loss, but recognizes that we want support with what's going on, what tips or words of wisdom or just, affirmations do you have for caregivers when communicating with healthcare providers about what we think the concerns are, or even if we just don't know, like we can't put our finger on it, but something's just not right. So any tips or words of wisdom for us to wrap up?
You want me to start, Dr. Attia, and then you can finish?
Yeah, go for it.
Okay. So kind of touching on what we've all said. So knowing what is normal for your child is probably the most important part in identifying what is not normal, right? So, keeping a food diary or just taking little notes of like, well, today he only ate this or didn't eat that, or any concerns at all, just keep track of it. So you have a mental note. Because I think what happens a lot of times is we have all of these concerns and we're so worried and we're passionate because we're parents, right? And then we get to the office and we're like, okay, so what's going on? And it's kind of like brain freeze. You're like, well, I had this list this one time. So I think just giving yourself the benefit of the doubt and writing down any little thing that seems out of place, it's not going to hurt to ask, because there are things that we are asked all the time that I'm like, oh no, that's very normal. I actually had a conversation with a parent today versus another thing his child was doing was not normal. So, and he didn't really know the difference between the two. So I think, what we don't know, we don't know. So I think writing down your questions, keeping a list of things. And if you're having a conversation with one of us and our medical terminology is just above your head, say that. Say, okay, I know what you're trying to say, but that word, I don't know what that means. And we can kind of, tone it back, be more personable, and just make it to where you feel like you really are a part of your child's care and you really understand what's going on. Without that piece, we're not going to see as much progress as we want. So we can give advice all day and we can come up with this plan, but if you don't feel confident and comfortable with that plan as well, we're only going to get so far, right? So I think it is important to just use your voice, take notes, and don't be afraid to ask questions.
Okay, I love that advice too. And I love the idea of just don't be afraid to ask questions. And I know we say that all the time in the medical world and the therapy world. We say, there are no stupid questions, but this is really one area where I think it holds so true. Touching back, we've mentioned a little bit that there is kind of a lot of misinformation floating around out there. And most of that comes from a very good place and a very understandable place. Really, just to give you some background on our field, we've known that for a very long time that kids have trouble eating. But really, until even the last 10-ish years, we didn't have a good way to define that, even in the medical community or the therapy community. So the most common names for the diagnoses that we have were not even defined in our literature until the last 10 years. So it's understandable that you have questions. We still have questions. So just don't hesitate to ask. We know that, the things that you're concerned about are coming from a good place. You are trying to care the best you can for your children. I know a lot of parents come in and I can just tell by the look on their face, they come in and they say something like, I can't get my kid to eat. And you can just see how embarrassed they are to say that, or sometimes how much guilt people have if their child isn't gaining weight, because we care so deeply for our kids, and we really feel like, sometimes we can feel like if our child isn't eating and growing the way that they're supposed to, we can feel like that we've not done our job. I very much hope that when you leave my office, you don't feel that way, because it is so complicated. You could tell by all the different professions that are involved in eating, all the different names that we've thrown out, that it's a very complicated thing. And it's okay if you just come in our office and say, something's not right. I don't know what it is. What do we do next? And we will start from right where you are and try to help you figure out what's going on.
Ooh, this is like therapy for the soul. Dr. Attia, do you have any final thoughts or recommendations or words of wisdom?
Yes. So I think part of something I just want to add is also keeping things in perspective. So sometimes when our child is fighting us in terms of their choices, it can just feel very distressing and overwhelming. And it's okay to just take a break from that. As long as your child is maintaining their hydration, they're peeing, they're not like fainting, they're not going to die from what is happening in that moment. So sometimes you just need to step away and like let go of that struggle for a little bit. And sometimes even just taking the fight out of it can help. I also wanted to, in terms of framing, having perspective and maintaining expectations, one thing just to be aware of is these resources that we've talked about are not numerous. we don't have many pediatric gastroenterologists, many speech-language pathologists or OT or pediatric trained registered dietitians. So there is going to be a bit of a wait to get in to see these providers. So just keep that in mind as you're exploring kind of what you're doing, that don't lose hope. You will get in eventually, and we are here to help you. So I think that in terms of speaking to your providers and what to say, Sarah and Jamie really summed it up really well.
Goodness, we cannot thank you enough. So our one of our, we have re-elevated the African proverb, it takes a village, and kind of framing it around feeding children. And so really recognizing that it is messy, and I can't remember who, but you said we're constantly learning or relearning or sometimes unlearning things that we've learned growing up. And so knowing that we are not alone, that we have resources, we have people like our friends from UK Healthcare that are available, and their counterparts. And so we'll be sure to link those resources so that you all can check out. We've checked out some of those websites and they look amazing. So Anna, any final thoughts?
I don't think so. Just again, saying it one more time, thank you all so much for joining us. We really appreciate it, and hearing your perspectives again, both professionally and personally with your littles.
Our pleasure.
Thank you for having.
Thanks for joining us for another episode of Snack Club. Resources related to the topics discussed in this episode can be found on our website, linked in the show notes. Your local cooperative extension office is also a wealth of information and can provide links to local resources.
If you have other topics you would like to hear about, send us a note at snackclub@uky.edu. That's snackclub@uky.edu. And as a reminder, the digestible bits of information we share are like navigation signs for your feeding journey, but you may need to contact a healthcare provider for more personal advice.
And last but not least, special thanks to our team behind the scenes. Mindy McCulley for bringing this audio and video file to life with her technology skills, and to the people through her marketing magic. And to Kelly Thompson for her creative ability to turn one conversation into our Snack Club symbol.
We hope to see you again soon.